I don't think they'll ever ask you on the exam which one's nucleoside, which one's nucleotide. But hey, if you can just remember T for T, the rest is nucleosides, that's easy. This is important to know. All need to be phosphorylated to be active. And what they might ask you is which ones need phosphorylation, which ones do not need phosphorylation. Yes. This can be used for general prophylaxis and during pregnancy to minimize risk of fetal transmission. They might give you a female who's pregnant, she has HIV, and they ask you which drug to give. Obviously, zidovudine is fair. You can be used for general prophylaxis. Now, it's only a few words, but when you add 700 pages of first aid, you have to read, not have to, but you want to, and it's all facts, 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 my friends, it's going to be very hard. That's why this is just like glorified Anki. Anki. Again, I got many doctors. I have my many doctors actually that love Anki. And again, I love using it if it works for you. But isn't it nicer to say, well, okay, hold on a second, hold on. I could read, but then I could choose certain techniques like Anki and rapid review for certain things. I just have to keep things short-lived here for the exam. But what do you choose? When you come to this section, like, all right, well, I can take my time. This is a simple question because they're just asking me, yo, we gave this to the patient. What happens? What happens? So it's either easy or difficult answer choices. The easy ones we all get. The difficult ones are challenging because they're difficult. So you say, okay, well, integrase, I know, double check, 50% went here. Shame, because integrase is not this. We went over. Anything that has tegra in it is a freaking integrase. This is not integrase. We went ahead and deleted this one, fusion. We took that out because that's a fervotide. That's easy, right? Took out this cleavage, boom, that's a Navir. But I have a question for you. When you open up here in your first aid and you go to the Navirs, what does it say here? Prevents maturation of new virions. Maturation depends on HIV protease, which cleaves the polypeptide. Wow, word for word, huh? Yeah. I don't blame you. I get pissed too. The problem is there's so many words to remember. What are you talking about? It's impossible. That's why the more answer choices you read and review, the more you improve your vocabulary. Because test writers, which I do write questions, not for USMLE, because I have to disclose this, not for the actual USMLE, but I write questions. And what my team does is we do this purposely. We're told, instructed by our superiors, yo, we want you to do this way, this way, this way, hit him hard. Okay, no problem. I take word for word and I mix it up a little bit. That's what I do. That's what we all do. Dr. Conrad Fisher, Dr. Golgin, all my seniors and my mentors that I still look up to do the same exact thing. So this is not difficult, but it's challenging. Yeah, it is. Read it, understand it, and be familiar with this information. You do this, they will never get you. This is what you can fix on your test. Forget about learning big concepts. It's not easy, but I still attack them with you. For example, shock. There's only a couple shock in cardio. Hypovolemia, low volume. Cardiogenic, it's in the name. The heart's not working, the pump. Neurogenic, there's a misconnection between the brain and the heart. Okay. Septic shock, you are infected with a bug, you have sepsis. And then you have obstructive, which is basically a pulmonary embolism. Okay, no problem, big deal. But do you know the physiology? No. Maybe you do, maybe you don't. Can you understand the ups and downs? You should. So if you have a problem, you go to the QBank, you say, I want to go to the cardiology section. I look for cardiogenic shock, hypovolemic shock, learn them. There's only 5. You'll never get them all. Same thing here. Learn the drugs, you're good to go. Yes, yes, yes. That's what I need you to do. You do that, my friends, you'll be good. Trust me on this. It's professional. You'll take care of business. This is what has to be done. This is a game you have to play, okay? So when I teach you this, there's a reason why I'm teaching this information. You have to do it this way, okay? For example, ready? Total example. You know the medications for TB? You should. There's only 5. RIPES. There's 5. Rifampin, isoniazid, pyrazinamide, ethambutol, streptomycin. Okay, check this out. The pathogen identified on sputum culture is found to be resistant to multiple drugs, blah, 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 streptomycin. Stop. I stop right here. I don't care. But yeah, do I have to read more? No. There's only 5 drugs. RIPES. S is streptomycin. Streptomycin is what? Do you know what streptomycin is? Let's say you don't know. All right. Let's say you don't know. You do know the other ones, right? You do know the other ones, do you not? Well, let's go right here. Watch. Ready? Boom, boom, boom. Watch. I'm going to put isoniazid. Isoniazid. Yes, Dr. Stavros, isoniazid, B6 deficiency, yada, yada, yada. Yeah, no problem. I know you know that. That's awesome. I'm proud of you. Congratulations. I know you know that. Do you know the other ones? We have rifampin, isoniazid, pyrazinamide, ethambutol. There's 4 plus S, RIPES. Okay. Now, look at the answer choice. All right. The answer choices are important. That's it. That is your safety net, your emergency out. So what I do is I win. Because I win, I'm confident and I win. I want you to always win too. So first plan, read the question, get the answer, move. Okay. Second plan, plan B, if you need it. I don't know what the question is asking. It's okay. I have power of elimination. Knock out the answer choices. Boom. Third plan, plan C. If plan A, plan B doesn't work. I have no freaking clue what the question is asking. I cannot eliminate. But what you could do is look at the answer choices. And if you need to look at them, they will help you direct where you should be thinking about the question stem. Meaning, look at this. Arabinoacyltransferase. What drug is this? What drug is E? Put in the answer choice. Put it in the chat, right? I want you to put E. And then I want you to put the answer. E is what? Arabino. Oh, that's a TB drug. Mycolic acid synthesis. That's a TB drug. 30S. Well, buy at 30, sell at 50. Buy at 30. Buy at 30 is aminoglycosides or tetracyclines. Got that. Inhibition of bacterial synthesis. All right. Rifampin. That's fine. And we have this bad boy here, right? So now, if you didn't know this, it's okay. You know why? Because you go to the top. A 61-year-old female, India, 2-month history of fatigue, fever, night sweats, productive cough. Oh, they're going to spoon feed me something. I'm ready for it.